Okay, it is Tuesday, December 8th. Welcome, everyone. Thank you to any first-time viewers or people tuning in. We want to welcome you on behalf of the Emory Alzheimer's Disease Research Center. And every Tuesday since March 31st, from 2 to a little bit after 3 p.m., we have been bringing you lots of great content to help you age well during the pandemic. Our mission as a research center is to ultimately develop interventions and discoveries and hopefully a cure for memory disorders. We have over 40 research projects that we are currently engaged with, but as a result of that, we still want you to age well as an adult or a caregiver or just someone who is interested in supporting the science environment. So welcome, thank you for joining us. So what do we do here today? If this is your first time joining us, you're going to hear from quite a few individuals today, and we're going to pack a lot of information in a short amount of time. So go and get a notepad and ink pen. I want you to take notes. The meeting is being recorded, and if we have your email address, we will send out a link to the video. But what do we do every week? We begin with exercise, because what do we say? What's good for your heart is good for your brain. So who are you going to hear from today? You're going to hear from Dr. Ken Hepburn. He is the director of our Outreach, Recruitment, and Engagement Core. He's also the director of the Emory Royal Center for Dementia Family Caregiving Mastery. Then you're going to hear from Dr. Monica Parker. She is our resident outreach guru, and she goes all over the country and the world and shares insight about how to keep your brain well. Then you're going to hear from Dr. Amber Schmidtke. I got it. She's going to be talking about COVID, and she is a college instructor as well as a microbiologist. But don't let that deter you. Remember, we try to keep things very basic, but we give you a high level of content, but we make it easy to understand. We'll share a PDF of the slides after the program, and remember that is copywritten. It's just for your sharing opportunity, okay? And then we're gonna close with a live music demo. We always talk about things that are neuroprotective, and music and exercise and even just learning, doing this every week is neuroprotective. So one surprise that you will have is that John is actually going to also end the program today with exercise, okay? So lots of fun activities. We're going to keep things lively. I know we do a lot every week in an hour, but we want to keep you active and engaged. So without further ado, John, take us away, and then he's going to close out the program as well before we wrap up today. So John, tell us what we need to do to get active and how we're going to stay active today during your demonstration.
Hey, today, first of all, I want to make sure everybody has a comfortable and strong chair, because we want to make sure everyone is safe. And also, we're going to need our water bottles. If you don't have water bottles, don't worry about it. If you have canned goods, if you have anything that you can hold in your hands for resistance, go get them right now. But like she said, I'm going to give you some body sculpting in the beginning, but then later on today in this program at the end, we're going to really get that cardio up and have a day party. All right? So first of all, I always want to say welcome to the Alzheimer's Disease Research Center from Emory. I'm John Lewis, and let's get started. Here we go. Hey! Elbows up. Come on. There we go. We get that chest. We get some shoulders. And we get that back. Come on. Incline. There we go. There we go. Let's go about. Now we really engage in those shoulders. That chest, those backs, rest. Here Here we go. There we go. Go. We getting that back right now. And we getting that out of chest. There we go. Come on. Come on. Rest. Here we go. Come on, stay with me now. Let's go wider. Let's go wider. Come on. Rest. Woo. My shoulder's burning right now. On your hand. And let's alternate. Now we get that lower chest. Those lower back. Turn them. There we go. Let's go up. And rest. Good job. Now I want these biceps. There we go. Come on. Keep it going. Keep it going. Rest. Turn them hammer. And rest. Now I want you to get them down and pull up. There we go. We body sculpting that entire body, upper body right now. And we get good cardio. Rest. I want you to feel forward, bend your arms, pull. Back straight now, back straight. Great job, great job. Stay with me now, one more song. I want to get those abs and that core. And I just want y'all to feel good right now. Come on, come on. I just want you to feel good and feel happy about life right now. Oh, come on. Give me that waistline right here. I'm gonna turn it a little bit. There we go. Pull it, pull it, pull it, pull it. Can I get the other side? Can I get the other side? There we go. I see y'all out there. And I want to see some of them happy faces now. Make sure you smiling and feeling good right now. Come on, get them hands up. Come on. Now we really elongate that diaphragm. And we get that entire core. If you have any back problems, we loosen it up. Come on, come on. Come on, 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 rest. Okay. I just want you to lift that leg up. There we go. Now we get those lower abs. Can you put a little crunch on it? There we go. Let's switch. Come on. Come on. You have to lift your legs to get the lower abs. You get the knee and the upper. Now add a little crunch with it. Come on. Remember, do what you can. If you need to take a break, take it. Rest. Come on. Legs wide. I call this rock to the grave. Hey, hey. Come on. There we go. Y'all get ready for a lot of information. I need y'all blood going and get excited by the information the people y'all about to hear from. Let's go. I'm about to finish now. Stay right here. Stay right here. And great. Remember, at the end, We're going to really get that cardio, and we're going to finish with a day party. So get all the information in, and I'll see you later at the end.
All right. Thank you, John. We always appreciate how you keep us moving and active, and you get our hearts pumping and ready to hear all this great information that we are getting ready to hear. So I want to welcome Dr. Hepburn. Thank you so much for joining us, everyone. I'm going to make you a co-host so that you can share your slides.
Okay, thanks. Let's see. Well, happy December 8th, everyone. It's really, for those of you who are in Atlanta, I'll just verify that it is indeed cold out there. Today's topic is, I still need to be enabled to share my slides, is what are the effects of COVID on providing care at home for a person living with a dementia illness. We've been in this since, we've been doing this since March 31st, having these sessions, and it was really, I think, February 17th that the restrictions were enacted in lots and lots of states. So we're coming up on 10 months of living lives that are sort of governed by sets of restrictions that we many of us choose to observe, if only reluctantly, in order to protect ourselves and to protect our loved ones. I'm still waiting to be able to share my screen here.
Any luck, Ken?
No, not yet.
Okay.
So the issue is, you can run it.
Right.
Oh, no, I got it. Okay.
Yeah. Okay. Yeah, a little delay here. I apologize.
So we want to talk about the effects of COVID-19 on home life for the person living with the dementia illness. So just this will kind of give you all a chance to reflect on what does home life look like over these last 10 months, and particularly if you're caring for someone living with a dementia illness. So that without a doubt, we're living days that feel longer and more isolated, and prizes to anyone who can remember that this is Tuesday. So it's very it's a sense of being isolated in space and even kind of in time, and isolated within community. So we're really feeling very alone. Those are contributed to by the fact that there are constraints in leaving the home. I mean, even if when you leave the home, there are rules to follow when you go various places. Institutions on which we have relied, particularly in caregiving, things like adult day centers, senior centers, churches, right? Religious institutions, civil community institutions, places that we would normally go to in the course of a week are closed or limited and restricted. So an option for social interaction or interaction of any kind has been, if not totally cut off, certainly severely curtailed. There are limitations that we have put on having people enter the home and that other people have put on themselves. So those of us who didn't travel for Thanksgiving, those of us who didn't have family in, understand very well that choices have been made that normal interactions are no longer present in our lives. So the days are longer and we are more isolated. And then lots and lots of us are doing more than providing care for a person living with dementia. Lots of us continue to work from the home, trying to work and keep an eye on a person living with a dementia is tough. And certainly all of the homeschooling that's going on for the majority of caregivers are sort of children taking care of parents, many of whom have their own children. These are other pressures. So we're isolated and pressured, and the days just feel longer. So we're living in homes that have higher emotional temperatures. There are more demands, I think, on caregivers, therefore, to create opportunities for engaging the person with the dementia in activities that are safe and pleasant. Just have to do more of them. Because we're isolated in so many different ways, there's less stimulation. The stimulus is coming from the caregiver, and it's coming from what the caregiver is setting up. And so it's more of, it's just the two of us here. It's just you and me on this desert island. So that's what life looks like. Now I want to share a model I may have shared before that's wonderfully called the progressively lowered stress threshold model of behavior in dementia. But if you want to have a good time, and maybe John can work this into his routine, if you try saying progressively lowered stress threshold 4 times rapidly, that'll get your heart going. What this model says or tells us is that in ordinary circumstances, in persons who are not affected by a dementing illness, the capacity to juggle a lot of things is pretty high. We can do a lot of things, keep a lot of things going, and remain sort of balanced and in control. We also have the capacity to understand if things are getting out of control. There's too many things going on, and we have protective mechanisms to reduce the number of things so that we can kind of keep under control all that is going on in our lives. What this model says is that if it's applied to a person who's living with a progressive neurocognitive illness like Alzheimer's or any other dementias, this zone of comfortably keeping things in balance is shrinking as the illness is progressing. So the person is able to take less and less, handle fewer and fewer things. And also that capacity to know that things are about to go over the top or that not enough is going on, that's going away. And so there's no way to sort of compensate when things are getting out of hand. So now you're living with a person whose capacity to manage stress is shrinking. And you're doing so in an environment whose emotional temperature is hotter. So you've got an environment that is effectively working against this dynamic of the shrinking capacity to handle stress. So I think it's really important to recognize that these two things are working in concert with one another, and they're doing so in a way that produces a greater capacity for overstimulation and maybe some sort of catastrophic reaction of a very uncomfortable behavior, just the person becoming really, really agitated, or if so too little is going on, for the person to become understimulated and to kind of shut down and draw into herself and kind of curl up into a ball. So these two things are working together. So what's a caregiver to do? Well, the first thing I want to start with is attend to yourself. Okay, if your temperature is rising, if your stress level is rising, believe me, that is communicated clear as a bell to a person whose cognitive powers may be waning, but whose emotional receptivity is really kind of wide open. So if you're heating up, attend to that. Watch your own threshold. Are things getting out of hand for you? And if so, give yourself permission for some self-time, even if it feels like I must be neglecting this person. You've got to take care of you in order to keep that temperature level kind of within reasonable range, and call in others to help. Even if it feels a little nervous making to do so, the precautions. Bring others in for help. So that's on your side. On the caregiving strategy side, just acknowledge you have a longer day. And so you got to build a calendar that is bigger than it used to be before last February. You have a bigger set of routines that you need to schedule and account for. It may not so much feel temporally longer, it might be, but in terms of the amount of attention you got to pay, there's a more. And so instead of having done perhaps one thing in the afternoon between lunch and dinner, you have to recognize that two things might be needed. Repeat chestnuts. What that means is things that work really well. Don't worry about repeating them day after day or every couple of days. Man, if you got something that works, let it work. Allow more passive engagement activities. So you might feel constrained or responsible to kind of the sense, I want to keep the person active, I want to keep her or him engaged. And so they should be, really actively engaged. But passive engagement is also okay. If you have a great book of photos, if you have a terrific set of YouTube videos, if there are some things that you have recorded on a DVR that the person really likes to do, let her do those things more than you might feel comfortable doing if we weren't under restrictions. And try to move out of the home if possible on a daily basis. Even if it's just to get outside to walk up and down a driveway or walk up and down the street, the act of getting somebody dressed, going outside, being even if it's cold, it's sunny out there, great vitamin D day. And then coming back and getting back into the household clothes, having a cup of tea, make that part of the routine too. So the temperature's risen, take your own temperature, build strategies that allow the temperature to remain pretty calm and comfortable for the person. Don't worry about, having to be terribly, terribly creative. Repeat stuff that works. And most of all, just recognize this is real. This is really happening. So I think that's what I got. And yes, that's what I have.
Thank you, Ken.
Yeah.
Such sage advice. And so I think this topic was really timely because over the course of our physical distancing the last 10 months, as you said, we've heard from many people who have talked about their loved ones just having this rapid decline due to the disruption in routine. So I would add, your tips apply to many households, as one of our viewers has just mentioned. So is there any additional advice other than I would just say let yourself off the hook. Don't be so hard on yourself. That's something I have to remind our household.
Yeah. Man, I think that is such great advice because we all hold ourselves so terribly responsible. Caregivers are notorious for doing that, and yeah, I think that the sense of decline probably is on both sides. That there is a certain kind of decline that happens for a person because of the because of the isolation, maybe the lack of stimulation. But the other side is that the caregiver is, because of the isolation, probably observing a lot more carefully and in greater detail. And maybe what's going on is that the caregiver is seeing stuff that was actually there, but seeing it somewhat more clearly. And so it feels like, oh my, this is really it's getting worse. Maybe getting a little worse, but it might not be getting quite as bad as you think.
And just one other closing observation. Do you have a recommendation or a way, do we bribe them? Do we tease them if they just refuse to get up and get dressed or move around as you recommended?
Everything we teach is about person-centered care. And so if this is a person who used to kind of relish being teased, then yeah, tease. If it's a person who's always been kind of prickly, I'd sort of stay away from that. I think the idea of asking a person to help you to do something often is really good. Providing compliments as a way to get a person, you look so good when your hair is fixed. That's what people say to me, by the way, all the time. Those kinds of strategies, you have to be a little bit seductive. I hate to use that word because it feels very manipulative, but you really want to draw the person out in ways that she or he kind of always like to be drawn out. So go back to who the person is, what the person really liked, and try to make your strategies fit with the reality of who the person really still is.
Excellent. Okay, well, moving on. So Dr. Parker, welcome. Hello. Today, she's going to be talking about memory loss, dementia, and Alzheimer's drugs. You're hearing a lot about vaccines. We talked about this over the summer, and it's just prudent that we revisit this topic. Hello, Dr. Parker.
Hello, how everybody? Okay, what Ken was talking about was very real for many of us as caregivers, and one of my tips that I always tell my families is try, and Dr. Hepburn does this too in some of our caregiver training, try to enlist other family members who are part of your family bubble to assist with things. I think that the problem with caregivers, particularly daughter caregivers, is you think you have to do everything, but you don't. And one of the things that you have to be encouraged to do, particularly if you have other caregivers and family members who are in your bubble who are assisting, is give them that opportunity, because that helps all of us. So my task today is to talk about Alzheimer's treatments and research in general. So this is the key slide here for me right now. Depending upon whatever your neurodegenerative process is, neurodegeneration is generally something that isn't recoverable. Our objective at this stage with respect to Alzheimer's and related dementias is to prevent their onset in the first place. So right now, for Alzheimer's and other neurodegenerative diseases, there is not a definitive cure or disease-modifying therapy, as we will call them. Current medications that we use in the management of these diseases is just to help you manage the symptoms. It's not there to treat or cure the process. Thank you. Next. So last week we talked about risk factors, or we talk about risk factors for Alzheimer's and related dementias all the time. And I think the most important thing that I can give you on this slide is to tell you that there are things that you have an opportunity to control. You can't manage aging. If you've got inherited good genes and longevity, you're going to be here for a minute. If you're a male or a female, that's not something that you determine, that's something that you were given. You can manage head injuries or your risk for head injuries. When we talked about chronic traumatic encephalopathy, and a couple of weeks ago, Dr. Stern came on to talk about head injuries and trauma. Vascular disease and lifestyle are the 2 items on the 6-item list that we have the most control over. So When it comes to lifestyle, that's what we eat, how much we exercise. That's why we have John here. And that's why you learn how to do so many more things. Cardiovascular disease, i.e. high blood pressure, high cholesterol, diabetes, heart failure are all risk factors for vascular dementia. It's not Alzheimer's, but some research is ongoing that shows that there is a connection between these cardiovascular disease processes and the turn on of the Alzheimer's type cascade. Next, please. So what are some of the symptoms of dementia? Alzheimer's, maybe Lewy body dementia, maybe frontotemporal. We're all familiar with memory loss. Yes, that's something that happens when people start repeating words, phrases, and stories and can't remember one thing from 1 minute to the next, repeating statements. That's a warning shot, if you will. That's something that means that we need to pay a little bit more attention to how they're functioning. Loss of bowel and bladder function. Yes, people, that is a brain function. Think about your toddler. You have to get him or her to recognize the urge to urinate and to defecate and connect that with, I got to go to the potty. Okay. Same thing with older adults. They're losing that connection. Inability to independently dress yourself, groom yourself, toilet, feed, manage bills, and prepare your own meals is another sign that somebody may be developing problems with brain dysfunction or the onset of dementia. Gait instability goes along with brain shrinkage, and in that part of the brain that controls motor function, there's going to be a deterioration there. The objective with all of these dementia symptoms is to help you understand that dementia is a multifaceted kind of problem. Brain functions are complex, and that it's not just one thing that is indicative of dementia. There's several things that your brain helps you do. So this is not just memory loss is not the only thing that you should associate with Alzheimer's or related dementia. These other things are also part of what your brain helps you to do. Next, please. So how do you address behaviors and symptoms that you see? Well, you need to get to a qualified health professional and other professional when you do recognize them. People who have dementia don't make good sense because they don't necessarily have those abilities anymore. A lot of times we need to make sure that somebody's not on medications that are causing the symptoms that we're seeing or the behaviors that we're observing. In addition to seeing a medical professional to make sure that there's not a treatable medical illness, you may want to confer with an elder care attorney to make sure that our own, as well as our loved ones' financial affairs and business affairs are in order. In the event that any of us got sick and had to go to the hospital, if you were unable to make decisions, did you put down, I don't want to be on a ventilator? Did you tell your children? Did you tell your spouse that? Is that written somewhere? Does your doctor know that? Somebody just flashed me a sign over there that said, what are some of the treatable causes? Well, some of the treatable causes for brain dysfunction would be medication mismanagement, undertaking medications, thyroid disease, over or underactive thyroid disease, vitamin deficiencies, uncontrolled and unmanaged diabetes, poorly managed or uncontrolled hypertension, all of which can lead to the development of strokes. Those are things that are treatable. Some of the other healthcare professionals that you may want to engage in someone's care, other than a doctor and a lawyer, would be a social worker, a clinical social worker who can help you make decisions about where somebody needs to live, what kinds of assistance you need to have. And another person that you can talk to, and this is something that a doctor would probably have to order, is an occupational therapy assessment. An occupational therapist can come into your home and make recommendations about what needs to be done to help somebody improve their ability to dress, to toilet. But more importantly, the occupational therapist is somebody who can help teach you some of those techniques that Dr. Hepburn talked about, like giving them alternative things to do so that they're not convincing or changing some of their behaviors to the ones that you would want. I don't want to get out of bed. I don't want to take a bath. An occupational therapist can help you with some techniques that may help promote daily bathing and getting up and grooming. The other thing, and this is the last thing, I know that our objective is to get you to enroll in research, and as soon as pandemic restrictions are lifted. We want everybody who's been participating with us to participate in our longitudinal research studies. Certainly the memory study is one. The early aging study, Emory Healthy Aging study is one. But research is not a substitute for a comprehensive medical assessment. I've gotten a message that says that they've lost my video. Cornelia, is that accurate? I can see me and I can see the slides, so I'm thinking we're okay.
Yeah, they may need to log back in, or they might have minimized the video on their screen.
Okay. Couple of questions. What kinds of beverages? I think we had on our loop the kinds of diet we want you to follow. Lifestyle changes, heavy on the fruits and vegetables, and heavy on the water. Next, please. What are the goals of treatment? So people are like, well, I want to go to Emory and I want to get treatment for this Alzheimer's, like Emory can work a miracle. Well, our objective for developing a treatment for Alzheimer's is to allow somebody who has all of the feature risk factors that are consistent with developing advanced Alzheimer's to be managed such that we can maintain our ability to function independently, to do all those things that each of us does every day. Getting up, getting bathed, getting dressed, fixing our meals, eating our meals, amusing ourselves, okay? So the idea with Alzheimer's treatment is to prevent the decline that necessitates dependence on other people for one's personal care. Keep going. Okay, so what are the medications we're currently using? Okay, cholinesterase inhibitors, those are the brand names: Aricept, Razidine, Exelon, patches or pills, NMDA antagonists, Memantine or Namenda. And those are the drugs that we most commonly use when somebody has a given diagnosis of Alzheimer's, maybe even Lewy body or any of the others. People may be given additional medicines to manage some of the symptoms and the side effects that go along with dementia. Zoloft, citalopram, Lexapro, trazodone, mirtazapine are by definition antidepressants, but they have side profiles or additional benefits. In addition to helping you with your mood, they may help things like sleep or appetite. It's like, oh, they're not depressed, they just have dementia. Well, one of the soft signs or the earliest signs of impending cognitive change is depression. Depression is kind of like a risk factor for brain dysfunction and dementia, okay? Antipsychotics, those are medicines we generally don't like to use in older adults who may have memory problems, but those are really reserved for people who really do have mental health illnesses. People who, before they develop symptoms that might go along with dementia, had a diagnosis of schizophrenia, had a diagnosis of paranoia. Okay, those medications are necessary for those people. But in advanced dementia, people with significant brain deterioration may exhibit some psychotic features. They may hallucinate. They may see people that aren't there. And they may get paranoid, in which case a geriatric psychiatrist, family physician, or neurologist may add one of these antipsychotic medications. But that's generally for severe psychosis, severe psychotic behaviors. Thank you. Next. What are the treatment domains? Okay, there are symptom improvement and disease modification. There's a drug that you've been hearing about on several of our calls called aducanumab. That is what we call a disease modifying drug. That is a medication that is to stop the Alzheimer's process. It can't reverse the damage that's been done, but the objective is to stop the process such that further damage doesn't progress. Right now, we do not have in the United States of America or any place else in the world an FDA-approved drug that stops the disease or prevents its progression. All we have right now are the symptoms, medications that have been approved by the Federal Drug Administration to manage symptoms. And those are the things that we talked about a few minutes ago. There are drugs, several drugs that are undergoing phase 3 clinical trials, but again, they're not yet FDA approved, which means they're not available at the pharmacy with or without a prescription. Next, please. So aducanumab, this is the interventional disease modifying drug that's currently being developed by Biogen and Eisai Pharma companies. It's called a monoclonal antibody. That doesn't mean anything to you. All that means is it helps your body fight the disease. An antibody means your body develops a disease fighter within itself to help fight whatever it is it's fighting. Aducanumab is a drug that's completed phase 3 clinical trials, which means we know a lot about how much drug, the appropriate dose to use, what the likely side effects are, and how it should work in different people. Okay, this drug was stopped about almost a year and a half ago, but because it didn't reverse the stages of the disease or stop it. But there were other outcomes that were positive that showed that aducanumab did confer a benefit when given to people. So all of those patients who are in our aducanumab trials here at Emory and any place else in the world have been called back to resume this study because there were positive long-term effects and improvements in behavior that were noted. And so they're going to continue that particular drug, okay, at the higher levels of drug that were demonstrated not to be efficacious or not to have significant side effects. Okay, I'll look at some of these questions in the end. I can't answer all of them. They're popping up, but I will. Next. Okay, in summary, it's really important before you jump to the conclusion that somebody has Alzheimer's, in consultation with a clinical evaluation, comprehensive evaluation by your physician, to make sure that the symptoms that you see are not related to a medical problem that is treatable. Dementia is something that can be, can be caused by medication interactions. Dementia symptoms, I didn't say dementia, I correct myself. Dementia symptoms may be caused by medications, may be caused by poorly controlled chronic medications. Heart and lung disease are some of those chronic illnesses that may direct some adverse effects on brain function. Okay, there's no currently available medical cure or disease modifying therapy available. We're working on it in research, and we need participation from everybody to make sure that the research that is conducted results in a treatment process that's efficacious for all groups of people, all genders, and certainly age groups that are affected. Thank you. I'll answer the questions in the chat.
Okay, yeah, there's quite a few. And so, Dr. Parker, as we transition to Dr. Amber Schmidtke, our hope is to find a cure for research. You mentioned we are not actively engaged right now. I mean, we are hosting some visits, but what would you say to someone who is on the fence about research participation?
Well, because I'm a scientist, a doctor scientist, and because I see the value in research participation, if for no other reason but to make me a better patient and to better ask my doctor questions about things that can help me, I'm a proponent of research. As you are learning with the COVID pandemic and the vaccine trials that are ongoing, we need people from all different ethnic groups to participate in these medication trials because we want to make sure that the drugs that we're working on are working as well in all groups of people. And right now, if you hadn't participated in the vaccine trials, you're probably wishing you had, but there will be other trials that come along because I really strongly believe that the sooner you get involved in these things, the more likely you are to have benefit. Those people that participated in the aducanumab trials early on are some of the first people that are coming back because we're seeing some benefit. Wouldn't it have been nice to know that you had kind of like preferred treatment because you've been involved in research before? So I'm a strong proponent of research. And I think that one of the reasons we do these educational sessions is so that you can make an informed decision about whether or not you want to participate. We're not going to always have all of the answers, but I want to give you enough information so that you can make a rational decision about whether you want to participate or not. You make the decision about whether you want to get an MRI or whether you want to get a lumbar puncture or whether you want to do a blood test or not. For those studies that you want to participate in, I want you to know that those studies are available and that you can participate in them at any time that you want to. But more importantly, if you don't want to participate It's a voluntary activity. No money lost, no time lost. If you don't want to participate, you don't have to. We're not begging you to participate, but it is to your advantage to lend your ethnicity, lend your gender, lend your DNA to any of these studies that have to do with diseases that may be affecting your group, women with breast cancer or family histories of breast cancer. You should be getting yourselves involved in a breast cancer study. A lot of them aren't always disease things. They're always what makes me healthy, what prevents me from getting this. And so there's a lot of research that's not always driven by medication, but what can we do to prevent a particular outcome? That's what a lot of research is. And unless people participate, we won't know that what we're doing is effective. So for all the people who say, I don't want to take the COVID vaccine because I don't know that it's going to work in my group of people, it probably will not. But if you don't participate, we'll never know whether it works better for you or not. So participate.
Okay, such sage advice. All right, well, welcome, Dr. Schmidtke. Thank you so much for being here. Would you like for me to make you a co-host, or should I pull up your slides?
Sure, if you want to make me co-host, that's fine.
Okay, I will do that. Thank you so much for joining us. This is such an honor to have you here with us this week.
I am pleased to be here too. Okay. Can everybody see my screen?
Yes, looks great.
Okay, great. All right. So yes, thank you so much, Cornelia, for the invitation to be with you today. So what I do for a living is really kind of coach people on how to use data to make decisions in the context of the COVID-19 pandemic. I have a newsletter that's free, and I'll drop it in the chat, the link to it when I'm done talking. But you'll also have it through the PDF of slides that Cornelia is going to send around. But really what I've been trying to do in this pandemic is, again, help people to make evidence-based decisions. My newsletter is kind of like the weather report, but for COVID, so that people know what the risks are and that sort of thing. So, where we are right now for the state of Georgia, and if people are listening from elsewhere too, you probably have seen the news that things are on the rise. Cases as well as hospitalizations are increasing for the state. And that's something we worry about because we're already seeing some strain in our healthcare infrastructure. Our hospitals are seeing the burden. And so we want to do what we can to prevent anybody that we care about needing that hospital bed right now. And so although things are getting a little bit worse right now, we actually expect them to deteriorate further as a result of Thanksgiving gatherings. We know that everybody's tired of this pandemic. I am too. And we know that, there have been some slips where people have gotten together when, the advice was not to do so. And so we are expecting things to get a bit worse before they get better. But as you probably are already aware, this pandemic is not affecting all people equally. And so today we're really going to talk about some of the demographic data to kind of just remind you of, the guidance that's out there for being careful. There's a reason for it. And we're going to go through what some of that reason is. So we'll start by just sort of a look at how the pandemic is affecting different age groups. And so what you're looking at here in this table is how many cases, hospitalizations, and deaths have been seen for each roughly 10-year age group from the state's Department of Public Health. And in blue, one thing I've noted is the hospitalization rate for each of those age cohorts. And you'll notice for children, it ranges between 1% and about 6%. But in adults, as you get older, the rate goes up. And for those who are 60 and above, it could be somewhere like 1 in 4 people who gets COVID is going to need a hospital bed. Or if you're over the age of 80, about 1 in every 3 patients is going to need a hospital bed potentially. And so, it's pretty important that we take this real seriously. And it's kind of frustrating and not really fair to live through this historic time when, 71% of the cases are being observed in younger adults, but the lion's share of hospitalizations and deaths are being experienced by our older population. So we'll go through that a little bit here. And again, I don't say any of this to poke a stick in anybody's eye or to make anybody feel bad. There's no blame with any of this. But if we know the problem, then we can do something about it, right? And so what we're looking at here on this slide, these are cases, and it's based on age group. And what you're looking at is 8-week timelines side by side for each of those age groups. So this is looking at the most recent 8 weeks. And what we saw in the beginning when we had the summer surge as well, is that everything sort of begins with our 18 to 29 year group. Our young people, college students, who they're awesome, but they think they're invincible, right? And so they can do all these things. And so their cases sort of explode, but that's not where the cases stay. And so, what you'll notice is we're seeing increases across every age group recently. The increases are smaller among some of our older population, but unfortunately they have kind of dangerous consequences. So going back 1 second, remember that the majority of cases are between 18 to 59, but that, again, that's not where the cases stay in terms of some of the more severe forms of the disease. If we look at hospitalization data, exact same format for this graphic, you're looking at that side-by-side timeline once again. You see that hospitalizations, are ticking upward for each age group, but instead of being mostly centered around the 18 to 29 year group, now they're centered around our 60 to 79 year groups. And things are getting worse, unfortunately. So, this is one of several reasons, why even the White House Coronavirus Task Force is now saying that those who are 65 and older really should avoid any indoor interactions with people that they don't live with. And that's even with a mask, they're recommending that. So it's unfortunate. And I know that, Dr. Hepburn talked about the isolation that we're all feeling here, and I completely relate, but there's good reason for it. Okay, so if we look before, we saw that we had the increase mostly in the 60 to 79 year group in terms of where hospitalizations were mostly located. If we look at death data, then, whoops, I went back too far. If we look at, sorry, my screen is blowing up for some reason right now. But if we look at the death data in particular, what you'll notice is that we have incremental increases as you go up in age. And so where cases were mainly centered around 18 to 59 and hospitalizations were mainly centered around 60 to 79, what we're seeing here are the deaths go up in age, especially among those who are 60 and above. So, this is of course why we're being real careful, especially right now. And so how do we protect ourselves in this situation? Part of it is knowing where the risky places are. And so what these data are, I've submitted an open records request to the state and was able to find out how many cases we've seen for each cluster setting. A cluster is another word for an outbreak. How many of those clusters have more hospitalizations than others, and how many have more deaths than others. So there are certain places that if the virus gets there, it spreads like wildfire. And the top example of that is military barracks. And if anybody served in the military, you know full well that that is a clustered situation where people are right on top of each other. So it makes sense. But remember those community centers, that's one of our number 2 places too. So keep in mind that that's, there's a reason some of these things are closed right now, as much as we all miss them. As far as hospitalizations and that demand, some of our riskiest places are those nursing homes and long-term care facilities, but also things like funerals and religious ceremonies at churches and temples. Again, I know that that's something that we all really need right now, but there are risks associated with it. And so that's why it's helpful. Again, we're not trying to cast blame on anybody, but it's helpful to know where the problems are. And so again, on this theme of how do we protect ourselves, at this time, it's real important to try to avoid being indoors with people that don't live with you. And be especially careful about being with those younger folks, not because they're wrong or anything like that. We just happen to know that they have a higher burden of disease right now. And so your exposure risk is greater. Do make sure that you're wearing your mask anytime you're not at home. And that can be really tricky, especially, with dementia patients that may not understand why they're being asked to do this. It's important to make sure that mask is being worn correctly. You need to try to cover your nose as well as your mouth and have a snug fit against your face. And it's important to remember that masks and really any of our mitigation strategies, none of them are perfect on their own. They're really meant to be used in layers. And so I like this Swiss cheese model of risk mitigation that you see on the lower right-hand side, where each of these things isn't perfect. And we know that there are holes in the system, right? But if we layer enough of those pieces of cheese together, then none of those holes align. And so then you don't have an ability for the virus to get to you if you're employing more than one risk mitigation strategy. So it's not enough to wear a mask. You also need to wear a mask and social distance, or you need to be outside as well as social distanced, those sorts of things. So what can you do? I would gather outdoors as much as you can. I know it's getting chilly in Georgia right now, but compared to most states in the country, Georgia generally has better weather than others in December. So if you can move your interactions outside, still maintain that social distance, but it might provide the opportunity for that social engagement that you need. But also just, it's time to start thinking about what are we going to do for the Christmas holidays or New Year's or Kwanzaa or Hanukkah? How do we honor those traditions in a way that's creative during this pandemic and allows us to, still look out for one another and love one another and celebrate that season, but do so safely. So what tends to happen is if we don't plan, then things fall apart. So try to plan ahead so that you have a good strategy going forward for how you're going to do that. If you can, have your groceries and medications delivered to the house as compared to going out to do that errand on your own, especially if you're one of our folks that's over the age of 60. And if you haven't already done so, please, please, please get your flu shot. We know that co-infections with both diseases are possible, and you could be sick for one reason and asymptomatically spreading the other. So we really want to try to avoid doing that if we can. I think that's it for me today. These are the different ways to get in touch with me. In addition to the newsletter, I have a podcast, but I'll sign off for now. I won't leave, but I'll stop and drop my link in the chat in case you want to follow the newsletter. Again, it's a free resource. Thank you again so much, everybody, for inviting me to talk to you today. And I just want you all to be safe and be well.
Wow, thank you so much, Dr. Schmidtke. Can you just talk a little bit about the flu shot? Like, we're telling people to get the flu shot. We're telling people distance themselves. It sounds like outdoor activities, if you must, is the way to go. But what about the flu shot? I mean, if I'm wearing a mask, do I need a flu shot?
I think we should all be trying to get the flu shot if we can. We're all sort of waiting with bated breath for this COVID-19 vaccine. I know we're all real excited for it, but the good news is we already have something to help us with flu. And so, and we know that flu on its own can be fatal. So if you have a risk mitigation strategy for that, go ahead and use it, right? So that's my perspective anyway. And even this year, compared to last year, we have really low flu activity compared to the previous year. And a lot of that is because the same things that we're doing to prevent COVID are also preventing influenza transmission. But we also have the benefit of that vaccine.
And one last question. Someone said, what was wrong with the position of the last mask?
So what was going on? I just had to look at it myself. What was going on was there was some puckering of the mask on the sides. So there was an opportunity for air to come in through the sides. And so again, you just want to ensure a snug fit as much as you can. So having a properly fitted mask is important. And so that's really what that was trying to point out right there.
Okay, all right. Perfect. Again, thank you so much, Dr. Schmidtke. We will likely ask you to invite you back if you are available. Again, we will share all of her contacts and in the PDF, as well as the email that will go out. One last question. What about the shingles shot? Should seniors get this shot?
Yes, it is recommended. I think it's for everybody 55 and older. I need to double check on that. But yes, we do recommend the shingles shot as well. If you are able, there are some places that are doing drive-through vaccination efforts right now. If you're able to get that, that's a great, safe option to get that done. So yeah, I would go ahead and get the shingles shot if it was made available to me.
Perfect. And Dr. Parker, I think you talked about adult vaccinations a couple of weeks ago. All right. Well, we are at the top of the hour. We're going to close out with a few more presentations. So thank you all for hanging out with us. Whit, are you there?
Yep.
All right. Welcome, Whit.
Thank you
How's
so
it
much.
going?
I'm doing well. Great presentations today, everybody. A few things I'll keep it brief since we're kind of at time here. My name is Whit. I am the communications specialist here for the Emory Healthy Aging Study and the Emory Healthy Brain Study. And let's see if I can share my screen to our website, because this is a handy piece of information here. Oops, I'll do that. So we had some really good information today about, the rise of COVID-19 and some of the stuff that we're seeing here as far as the trends go. And as I work with the Emory Healthy Brain Study, our Alzheimer's focused sub-study, one of the things that we're actually having to do here is pretty much suspend all in-person visits going forward until we get through some of the holiday season and ideally see some of these trends, start to go back down and level out. Which really presents a unique opportunity here for research and some of the stuff that I've talked about before in the Emory Healthy Aging Study. Because this is a research opportunity where you can kind of get your foot in the door. You don't have to actually come in and see anybody because it's done entirely online. And so as we're moving into the holiday season, we're spending more time indoors. Obviously, we're not, conducting as much, in-person, face-to-face research for the safety of our participants as well as our staff. This is a really good time to, consider potentially joining the aging study because we've got extra time, as we're spending at home. We're not trying to venture out as much. And this is a really, like I said, easy way to kind of get your foot in the door. It simply consists of completing an online health history questionnaire. We ask that people do it once a year. And that questionnaire asks you different questions about your demographics. What are your health habits? How much exercise do you get? What's your diet like? As well as any kind of medical conditions you may have. And we ask that people update this once a year, and it takes about 30 minutes. And so it's a really easy way to kind of get involved with research. If you've been on the fence or thinking about it or, want to kind of test it out, I definitely encourage you to visit our website here, healthyaging.emory.edu, and I'll put that in the chat as well. And you can learn a little bit more about the research study here, some of the things that we're trying to do. We have some really great annual reports. And if you actually decide that you would like to join the study, we've got a big yellow button right up here in the top right-hand corner. You just click that and it'll walk you through step by step.
And you are going to post in the chat all of this information. I see we have some new viewers this week. We'd love for you all to check out several of the links that have been dropped in the chat and take some time to review that information, make a decision, or reach out if you have additional questions. All right. Thank you so much, Whit. All right. I still see 165 people on. So as we mentioned, we always have an exercise demo that we open with. And so John's going to close us out. But before he does that, we're going to invite Miss Dominique Johnson to come on. And she's going to do a live music production for us. Again, we want to keep things, filled with joy and happiness and just warm feelings for the month of December. 2020 has been a year. And so as we transition into 2021, we want to end on a note of hope. Okay? So thank you so much for being here again with us, Dominique, and take it away as we hear some live music, and then John's going to rev us up with a little day party, and then we will see you back next week. Next week, we are going to have Dr. Nadine Raphael, who is the director of the Vaccine Center at Emory. She's going to be telling you all the ins and outs of the vaccine. So be sure to join us next week and share with others, okay? All right. Hi, well, it's afternoon now, right? Okay, and I think you are muted. There you are. Okay.
Okay.
All right.
All right. Can you hear me okay?
Yes, sounds great.
Okay, so really quick, I'm gonna be playing today this Christmas. As you can see, I have my little 8-year-old son. Say hi. He's gonna be helping me out today on the drums. So we hope that you guys enjoy what we're gonna do. All right, you ready? 1, 2, 3, and.
All right. Thank you again. And tell us your son's name again. You did a wonderful job. Everyone is commenting how much, how great you were, how wonderful. What a great way to end the session, and just keeping our hearts lifted up as we close out this session. But we are going to end with exercise, okay? So stick around. Tell us your son's name.
My son's name?
Yes.
His name is Darren Jones.
Darren. All right. Good job. Excellent job. That was amazing. Thank you again. Everyone is commenting. Awesome. Good job. Wonderful. All right. Well, thank you, Ms. Johnson, all the way from Chicago. She will be joining us again next Tuesday, everyone. So if you have a particular request, get that in before next Tuesday. All right, John, get us energized as we close out this Tuesday. All right. We're having a day party. We just want to keep you guys lifted up.
Here we go.